In this video, we're going to be going over a tooth extraction and bone graft. What to expect with the extraction, do you even really need the graft, and what I recommend to our patients. So by the time we're talking about extracting the tooth, you've probably already had the conversation with your dentist about doing a root canal. The tooth may not even be fixable. The cavity may be too large. It could be fractured, broken. The infection is just too big. But for whatever reason, it's time to get the tooth out, like in this video. For us and the patient, the goal is always to get the tooth out as atraumatically and comfortably as possible in as few pieces as we can. Here are some questions I get asked by patients all the time. Is this going to hurt? The extraction should never hurt. Obviously, you're going to have some discomfort a couple days or maybe even a week after the procedure, but the procedure itself, you should be nice and numb for. You will feel a lot of pressure during the procedure and maybe hear a little snap, crackle, pop, but it shouldn't hurt. Is it something I have to be put under for? Obviously, there are exceptions to this as far as just patient preference, comfort, anxiety level. And if we're doing multiple teeth, for example, wisdom teeth that are impacted, sometimes sedation is just the best route to go. And how much does it cost? This will vary depending on where you're located and the fees of your provider. But in general, your office will either bill for a surgical or a simple extraction. The difference really comes down to how difficult the tooth is to get out and how complicated of a procedure it is or it becomes. The best example I can give is if you have an extraction done and it comes out in multiple pieces, breaks, they have to do a little bit of drilling, that's typically a surgical extraction. So what about the bone graft? Why do we even do them or recommend them? So it's important to keep in mind that most extractions will result in detrimental changes to the bone and soft tissue structure and architecture in the area that the tooth is pulled. AKA, it's going to cause it to shrink and lose a little bit of bone and tissue. And in general, the better that we're able to preserve the soft and hard tissue structure and architecture in the area, typically the easier it is to replace the missing tooth with something fixed such as a bridge or an implant down the road. So the name of the game with the graft is preservation, preserving the area the best we can. So how do we do the bone graft? So typically the same day that we take the tooth out, we will actually place the graft and will be the easiest thing we do that day, or it should be. And as you can see in this video, after we get the tooth out, there's basically a hole or a void there. And what we do is we fill in that hole or void with graft material to basically help plump up and preserve the area, and typically cover it with some sort of little blanket or collagen membrane to help keep it in place. This all should result in the area healing the best that it can. I know what you're probably thinking. Where does the bone come from? Most of the time, cadavers. But we can harvest the bone or get the bone from a lot of different places, such as the patient themselves, cadavers, or different species such as porcine or bovine, AKA cows and pigs. So do you really need it? It depends on a couple things. Most importantly, your future plans for the area, a conversation that you've had with your provider about replacing the tooth possibly with an implant or a bridge, or maybe even something removable, the location of the extraction, where it is in your mouth. So what do we recommend to our patients? In general, if one of our patients is at all considering a fixed solution to replace the missing tooth down the road, such as an implant or a bridge, even if they haven't made up their mind yet, then I typically encourage them to get the graft done. If the patient says, I don't care about this tooth, I know I'm not going to replace it, I know I'm going to be making a denture or partial down the road, and I typically say, we're just fine without the graft. The most important thing is just having the conversation as far as the pros and cons with your provider about what is best in your particular situation. An important thing to keep in mind is a lot of times bone grafts are elective procedures, so your insurance may not cover it and you might be out of pocket, and so be sure to discuss the cost of this with your provider. A single tooth graft site, depending on where you live, could range anywhere between $250 and $600 probably. So after the tooth out and the graft has been placed or not, it's time to let the body heal and do its thing. The timing for healing is going to vary between individuals and clinical situations. In general, the larger extraction sites, such as the molars and particularly in the back, are going to take a little bit longer to heal than maybe a tooth up front or a smaller extraction site. I hope that video helped and provided you with some useful information as far as what to expect if you're getting a tooth out, and with regards to the bone grafts, if you really need them or if it's not that big of a deal. So if you're going to be getting a tooth pulled or you're already missing one, be sure to check out one of our other videos where we go over a bridge versus an implant, which one's the best and which one I recommend to our patients, and how much do dental implants really cost. As always, thank you guys for your time. Please leave your questions in the comments below. Thank you.